Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a neurologist speaking with a patient called Mr. Keller. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Keller. My name is Dr. Sarah, and I'll be helping you with your current health concerns. How are you feeling today?
I'm all right, I guess. Just a bit sore and a little on edge, honestly.
I understand. I see here that you sustained a puncture wound on your hand. Do you mind telling me more about what happened?
Sure. I was doing some work in my garden yesterday, and I accidentally cut my hand on an old metal fence post. It's a small wound, but I cleaned it as best as I could and put a bandage on it. But now, I'm feeling tense, and my jaw is really stiff. I didn't think it would feel this way so quickly.
I see. Based on your description, it sounds like you could be experiencing early signs of tetanus. Tetanus can sometimes start within a day or 2, especially if the wound is deep or involves rusted metal. Do you know if you've had a tetanus booster in the last 10 years?
I'm not really sure. I think I had a shot when I was younger, but I haven't kept track of any boosters.
That's understandable. Let's talk about what tetanus is and why it's important. Tetanus is an infection caused by bacteria called Clostridium tetani, which is commonly found in soil, dust, and manure. When these bacteria enter the body through a break in the skin, they can produce a toxin that affects the nervous system, causing muscle stiffness and spasms, especially around the jaw, what's often called lockjaw.
Lockjaw? So that's why my jaw feels so tight?
Exactly. The toxin impacts the nerves that control muscle movement, starting with the face and jaw, and can spread to other parts of the body if left untreated. The stiffness and muscle spasms can become quite severe and even lead to difficulty breathing or swallowing, which is why it's important to catch it early.
That sounds serious. I thought a small cut couldn't cause something like that.
Yes, it's a common misconception, but even small puncture wounds can introduce the bacteria into the body, especially if they are deep and in contact with contaminated surfaces like rusted metal. The bacteria produce spores that thrive in low oxygen environments, which is why deeper wounds are a risk factor.
So what happens now? Is there anything we can do about it?
Absolutely. First, I'll check when your last tetanus shot was, as a booster may be needed to help your immune system fight off the bacteria. If we suspect that you're showing early symptoms of tetanus, we can administer tetanus immunoglobulin, which helps neutralize the toxin. Additionally, we'll clean and treat the wound to reduce any remaining risk of bacterial growth.
That sounds good. I really don't want this to get worse.
I understand. For now, though, it's important to know that tetanus can be managed effectively with prompt care. If necessary, we might start you on antibiotics to help prevent any bacterial spread, and will likely admit you for monitoring just to be safe. Tetanus, if it progresses, can cause other symptoms like muscle spasms in the back or abdomen and even more serious complications, but early intervention significantly reduces these risks.
Will I need to stay in the hospital for long?
If you're showing symptoms, We may recommend a short stay, mostly to ensure that the infection is managed well and that there's no risk to your respiratory muscles. Tetanus spasms can be strong enough to interfere with breathing, which is why we'd want to monitor for any such complications in a safe setting.
That makes sense. I didn't realize tetanus could affect so much of the body.
Yes, it can be quite systemic. While tetanus often begins locally, it can spread to other muscle groups if untreated. That's why timely care is essential. Thankfully, since you've come in early, we're in a good position to manage it effectively and prevent any serious complications.
I'm really glad I came in now. Is there anything else I should watch out for?
It's great that you're being proactive. In addition to muscle stiffness, watch for other symptoms like difficulty swallowing, shortness of breath, or severe muscle spasms. Also, if you experience increased pain or any discharge from the wound, let us know. For now, we'll make sure you're up to date on your tetanus immunization and we'll start treatment as needed.
Okay, I'll keep an eye on things. Thanks for explaining all this to me. I feel a bit better knowing what to expect.
Extract 2. Questions 13 to 24. You hear a doctor talking to a patient called Mrs. Sia. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Sia. I understand you came to the clinic because you've been experiencing some health issues over the past couple of weeks. Can you share a bit about what's been going on?
Yes, doctor. I started feeling unusually tired about 2 weeks ago. At first I thought it was just work stress, but then I noticed some other symptoms too.
I see. Can you tell me more about these other symptoms?
Sure. I've been feeling nauseous, and my appetite has really decreased. I've also had a slight fever, but I figured it would go away on its own. Then I noticed that my eyes and skin started looking a bit yellow, which really worried me.
I understand, and I can see why you'd be concerned. The yellowing of the skin and eyes, also known as jaundice, can indeed be a sign of liver issues. You mentioned feeling tired and experiencing nausea. These are also symptoms that could be associated with a liver condition. Have you noticed any changes in your urine or stool color?
Yes, actually. My urine has been much darker than usual, and my stool has become kind of pale, which seemed odd.
Thank you for sharing these details, Mrs. Sia. Based on your symptoms, it's possible that you may have hepatitis A liver infection caused by the hepatitis A virus. This infection can lead to symptoms like fatigue, nausea, jaundice, dark urine, and pale stool. We'll need to do a blood test to confirm this, as that's the most accurate way to diagnose hepatitis A.
I see. How could I have gotten hepatitis A?
Hepatitis A is usually transmitted through consuming food or water that's been contaminated with the virus, often due to poor hygiene or sanitation. Have you recently traveled to a region where hepatitis A is more common, or eaten any food that might have been prepared under less sanitary conditions?
I did travel about a month ago to an area where I wasn't sure about the water safety. I tried to be careful, but maybe I slipped up somewhere.
It's very possible that you might have been exposed to the virus during your trip. It can sometimes take 2 to 6 weeks for symptoms to appear after exposure. The good news is that hepatitis A often resolves on its own without causing long-term liver damage, especially with supportive care.
That's a relief to hear. What kind of care would I need?
For hepatitis A, treatment typically focuses on relieving symptoms and supporting your recovery while the virus runs its course. Rest is very important since fatigue is common, and you should avoid alcohol or any substances that could strain your liver. Staying hydrated and eating a balanced diet can also help manage nausea and maintain your energy.
Okay, I can do that. Will I need any medications?
There aren't specific antiviral medications for hepatitis A, but we can provide supportive treatments to help with nausea or pain if needed. Also, we'll monitor your liver function to make sure everything is on track. Most people recover within a few weeks to a few months.
That makes sense. I'm glad it's not a long-term thing, but is hepatitis a contagious? Do I need to take any precautions with my family?
Yes, hepatitis A is contagious, especially during the first few weeks of symptoms. It's spread through contact with infected fecal matter, so practicing good hygiene is essential. Washing your hands thoroughly after using the bathroom and before preparing food will be important to avoid spreading it to others. Your family members may also want to get vaccinated, as the hepatitis A vaccine is highly effective at preventing infection.
Good to know. I'll be careful. Is there anything I can do to prevent getting hepatitis A in the future?
Yes, absolutely. The best prevention is vaccination, which is recommended for people who travel frequently or may be exposed to unsanitary food or water. If you haven't been vaccinated, we can discuss getting you started on that once you've fully recovered. Also, being cautious with food and water safety, especially when traveling, can reduce your risk.
That sounds like a good idea. I'd like to avoid this again if I can.
I understand. Let's get that blood test done today, and once we confirm the diagnosis, we'll set up a care plan. In the meantime, focus on rest, hydration, and gentle foods to help your liver recover.
Thank you, Doctor. I appreciate all the information and the reassurance.
You're welcome, Mrs. Sear. I'm here to support you through this, and we'll work together to get you feeling better soon. Please don't hesitate to reach out if you have any questions.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse talking about the space admission process. Now read the question.
Over the next 48 hours, I will work with you to complete the hospice admission process. This includes several meetings to explain the steps and ensure clarity. During this time, I will conduct assessments, collect necessary medical history, and help complete the required paperwork. The first meeting will focus on reviewing the patient's current condition and eligibility criteria for hospice care. The second meeting will address the completion of legal and medical forms, including advance directives and insurance paperwork. The third meeting will introduce the interdisciplinary team, comprised of the hospice physician, nursing staff, social worker, and chaplain, who will provide care and support. Finally, the fourth meeting will outline the scope of care, including coordination of medication, equipment delivery, and scheduling the first home visit. At each stage, you will have the opportunity to ask questions and make informed decisions about the process.
Now look at question 26. You hear a conversation between a GP and a neurologist. Now read the question.
Patient with chronic tension headaches and persistent neck pain.
That's correct. Alongside the chronic headaches, the patient has also reported numbness and tingling radiating down the left arm. These symptoms seem to worsen after long periods of sitting or working on his computer. Additionally, I've observed a noticeable reduction in his neck mobility during my physical examination. While it's all outlined in the referral notes, I wanted to reach out because I'm quite concerned about the underlying cause of these symptoms.
I see. I've reviewed the imaging reports attached. I will assess the patient thoroughly during his appointment and call you with my findings afterward.
Now look at question 27. You hear a medical professional explaining implementation of new sanitation standards. Now read the question.
As you may already know, we're implementing new sanitation standards in patient areas to further enhance cleanliness and safety. You might have some reservations about how this could affect your daily workload, which is completely understandable. While maintaining high hygiene standards is crucial, we don't want to put additional pressure on our nursing team. That's why external cleaning teams will be primarily responsible for these new procedures. I've heard some of you worry that managing these standards might still add to your workload through additional checks or supervision. Let me reassure you that our managers will oversee the process closely to ensure these tasks are well managed, leaving you to focus on patient care without extra duties.
Now look at question 28. You hear a nutritionist talking to a patient. Now read the question.
What brings you in today?
I've been feeling down for a while now, and sometimes anxious too. I've heard that what we eat can affect our mood. Is there really a connection between food and mental health?
Yes, that's a great question. And you're not alone in wondering. There is a strong link between nutrition and mental well-being. You see, our brain relies on nutrients to function optimally, just like any other part of our body. For example, omega-3 fatty acids found in fish can support brain health, and deficiencies in certain vitamins, like B vitamins or magnesium, have been associated with mood disorders and increased anxiety.
That's really interesting. So, changing what I eat could help improve my mental health?
Absolutely. A balanced diet rich in fruits, vegetables, lean proteins, and healthy fats can make a significant difference. It helps regulate mood, and may even play a role in preventing depression or reducing symptoms.
Now look at question 29. You hear a discussion between a trainee doctor and a senior GP about complementary and alternative medicine, CAM. Now read the question. Dr. Patel, you've been researching alternative medicine for a while now, haven't you?
Yes, that's right. I've been exploring how practices like acupuncture, herbal medicine, and mindfulness can complement traditional treatments. There's growing interest in these areas, but integration into conventional care is still a challenge.
I've heard a lot of patients inquire about CAM recently. Many of them seem dissatisfied with standard treatments or worried about potential side effects. But then, there's the issue of evidence, whether these methods are truly effective and safe enough to incorporate into practice.
Absolutely. It's a complex issue because while some CAM practices have strong anecdotal support or cultural significance, the lack of large-scale clinical trials often holds them back.
And that's understandable. Patients need to trust that what they are using is effective and won't cause harm. However, I think a bigger part of the problem is the healthcare system itself. It often doesn't allocate resources to research or train professionals to integrate CAM effectively.
That's a good point. It's hard for GPS to recommend something they aren't trained in or fully understand.
Precisely. I believe the lack of institutional support for proper CAM integration is one of the key reasons we are seeing a gap here. Now look at question 30. You hear a morning briefing with a doctor. Now read the question.
Let's get started with today's briefing. Claire, can you begin?
Of course. First up, we have a 72-year-old man who is 3 days post-op following a total hip replacement. He has a history of hypertension and type 2 diabetes. He is now presenting with swelling and pain in his left calf, which began yesterday. Exam findings include tenderness along the posterior calf, mild erythema, and a positive Hohmann sign.
Thank you. So, what are the next steps?
Based on the clinical presentation and physical exam findings, compression ultrasonography and initiation of anticoagulation therapy are the next steps.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with Dr. Sylvia Park, an expert in digital health initiatives and patient engagement. You now have 90 seconds to read questions.
Digital health literacy is emerging as a crucial factor in empowering patients to engage more actively in their own healthcare. I'm Jandine, and my guest today is Dr. Sylvia Park, an expert in digital health initiatives and patient engagement. Dr. Park, thank you for joining us.
Thank you, Jan. I'm really excited to discuss this topic. Digital health literacy has become a central part of how patients manage their health, and it's something healthcare providers are increasingly supporting.
So, why do you believe digital health literacy is essential for patient empowerment and engagement in healthcare?
Digital health literacy equips patients with the skills to access, interpret, and use online health information and tools effectively. When patients are digitally literate, they can navigate telemedicine, manage electronic health records, and even use mobile health apps. These skills allow patients to make more informed decisions, giving them a greater sense of control over their health, which is fundamental to patient empowerment.
That makes a lot of sense. And how do healthcare providers fit into this? Do they play a role in educating patients on these digital health tools?
Absolutely. Providers have a key role in educating patients. While digital tools are available, many patients need guidance on how to use them safely and effectively. Providers can introduce patients to specific apps, show them how to interpret online health information, and even help them set up telehealth appointments. With this support, patients become more comfortable with digital tools and can use them to their full advantage in managing their care.
I see. But I imagine not everyone has the same level of access or ability to use these digital resources. What kind of barriers do patients face?
That's correct. There are several barriers, and they vary across different populations. For some, a lack of internet access is a major issue, especially in rural or low-income areas. Others may not have the necessary devices, such as smartphones or computers. Additionally, there's the matter of technical skill. Some individuals, particularly older adults, may not feel comfortable using technology. Language barriers can also hinder access, especially for non-native speakers who may struggle with English-based digital resources.
It sounds like there are multiple layers to address. Do you see any particular strategies being effective in overcoming these barriers?
Yes, there are a few promising approaches. Some healthcare systems are working on providing digital literacy training for patients. They might offer workshops or one-on-one support to help patients learn how to use these tools. Additionally, some initiatives are focused on making devices and internet access more affordable and available to underserved communities. By creating a more accessible infrastructure and offering tailored support, these programs can help bridge the digital divide.
That's encouraging to hear. Finally, what can patients do on their own to improve their digital health literacy?
Patients can start by exploring online resources from reputable organizations like the CDC or Mayo Clinic to familiarize themselves with the kind of health information that's available. They might also consider trying out a telemedicine visit with their provider, which can be a great way to practice using digital tools in a supported environment. The key is to start small and build confidence gradually. Even small steps in digital health literacy can make a significant difference in their health engagement over time.
Extract 2. Questions 37 to 42. You hear a conversation with Dr. Samuel Reed from the Department of Public Health at New York University. Now, read the questions. You now have 90 seconds to read questions.
Welcome to today's discussion. My guest is Dr. Samuel Reed from the Department of Public Health at New York University. Dr. Reed is here to discuss some findings from his recent studies on the impact of urbanization on public health. Dr. Reed, thank you for joining us today. What would you say is the most significant takeaway from your research?
Thanks for having me. One of the main takeaways is that urbanization, particularly in densely populated cities, has significant effects on both physical and mental health. While urbanization can provide better access to healthcare services and job opportunities, it also brings challenges like air pollution, reduced green spaces, and increased social isolation. These challenges can have a long-lasting impact on residents' well-being if not properly addressed.
Let's start with air pollution. How does urban air quality affect public health?
Air pollution is one of the biggest challenges for urban public health. Pollutants from vehicle emissions, industrial facilities, and construction sites contribute to a wide range of respiratory issues, including asthma, chronic bronchitis, and other lung diseases. Long-term exposure has also been linked to cardiovascular diseases and even premature death. Research shows that populations in urban areas with high pollution levels tend to have higher rates of these conditions. Cities need stricter air quality regulations and more green spaces, which can act as natural air purifiers to mitigate these effects.
What role do green spaces play in improving urban health?
Green spaces, like parks and gardens, are essential for both physical and mental well-being. Physically, they encourage exercise, which reduces the risk of obesity, diabetes, and other chronic illnesses. Mentally, they offer a place for relaxation, social interaction, and stress reduction, Studies have shown that people who live near parks tend to have lower rates of depression and anxiety, but many urban areas have limited green spaces, often because of a focus on housing and commercial developments. To improve health, cities need to incorporate more accessible green spaces into their planning.
That makes sense. How does urban living contribute to social isolation?
Social isolation is a growing problem in many urban areas, especially among older adults. With the fast-paced lifestyle, heavy traffic, and limited community engagement, people often find it difficult to connect with neighbors. High-rise buildings can also limit social interaction, as people rarely engage with others outside their own apartments. Social isolation has been shown to negatively impact mental health, increasing the risk of depression and even cognitive decline. To combat this, urban planners need to create spaces that encourage socialization, like community centers and pedestrian-friendly areas.
What strategies have you seen work in other cities to counter these challenges?
Some cities have taken innovative steps. For example, Singapore has integrated green roofs and walls throughout its cityscape, improving air quality and providing more green areas for people to enjoy. Copenhagen has created numerous pedestrian-friendly zones that encourage social interaction and exercise. In New York City, there's been a push to create more public spaces for social gathering. These changes aren't just about aesthetics, they're about creating healthier, more livable environments that support well-being.
What do you think is the biggest barrier to creating these healthier urban environments?
One major barrier is the cost of implementing these changes. Green spaces, pedestrian zones, and pollution control measures require significant investment. Additionally, there's often a lack of cooperation between city planners, health officials, and policymakers. Many cities are more focused on economic growth, sometimes overlooking public health priorities. However, studies show that investing in health-focused urban development leads to long-term savings in healthcare costs and improves residents' quality of life.
What are some of the concerns from residents about these urban health initiatives?
One concern is that initiatives like creating green spaces or improving air quality might lead to gentrification, where the cost of living rises, pushing out lower-income residents. This issue is often called green gentrification. Residents worry that as neighborhoods become healthier and more desirable, they may no longer be affordable to the original community members. Cities need to carefully balance urban health initiatives with affordable housing policies to ensure equitable access to these benefits.
Dr. Reed, thank you for sharing these insights. It's clear that addressing public health in urban areas requires a holistic approach.
Thank you. It's an important issue, and I hope these discussions encourage more cities to consider health impacts in their planning decisions.
That is the end of Part C. You now have 2 minutes to check your answers.